Before we really get started in what we hope is a discussion-rich part of our meeting, we thought it would be useful to provide a little bit of an overview about what IARPIC is for those who have not been involved before, a little brief bit about our team and why we're having this meeting. So I've been a member of IARPIC as a co-lead for the health and well-being team for a few years now. I'm one of those a bit different type of team leads because I'm not associated with a federal agency. I work for the state of Alaska. I participate really to bring some of the state of Alaska thoughts into the room. And that is part of what IARPIC is. It's this committee. It's part of the U.S. National Science and Technology Council. It aims to enhance scientific monitoring and research on local, regional, global environmental issues. And what I really like about IARPIC is that a huge focus is on coordination of various entities, your federal agencies, your state agencies, tribal, even international entities. So part of IARPIC is to develop the Arctic Research Plan, which is developed every 5 years. That's why we're here today, actually. It's time to develop a new plan. We'll get a bit more on that from Candace in a few minutes, but that is why we're here, so we can all learn a little bit. We're going to take a few minutes where we'll go through our previous research objectives and highlight a few of the things we've done in the past 5 years in this earlier Arctic Research Plan. And then we really hope to just get everyone's cogs thinking a little bit about what would be good to focus on in the next plan. Whether that's carrying over some of the objectives we've been working on and we realize that they're very important to continue, or maybe there's something new that we haven't really addressed. I know like harmful algal blooms, as mentioned earlier, is an interest, and it's definitely an interest in the state and not something that's really been an obvious research objective. So, thinking about those types of things. So this particular team, the health and well-being team, has, I think, the most research objectives of all the teams. And it's really just because health and well-being is so broad, as we all know, all sorts of different types of environmental change relate back to health and well-being of humans. Even when we're talking about, ecologic change, wildlife changes, especially here in Alaska where we have such a tie to the land. So our team does a lot of different things. We range from environmental stuff, more of what like I do in my typical job, to mental health, to subsistence, all kinds of different things. So if you have an interest that relates to health and well-being, chances are we address it in some way here, or we can definitely make a case for it in the next plan. So I think I'll stop there since it's a pretty, we want to get more into hearing from everyone on the call. As a brief intro, if there's any quick questions about IARPIC or our team, we can field that right now before we move on. Okie dokie. So it looks like next up, we have Candace, who can provide an overview of the Arctic Research Plan development.
Thank you so much. Meredith, can you put my slides up, please?
The slides are going up now.
Great. Good morning, good afternoon to everyone. It's great to be here with you, and it sounds like we have some new folks on. So hopefully some of these slides will actually be useful to you and not sound repetitive to many who've been hearing this presentation so far. And as I mentioned before, I am on a small interagency team that is working to help develop the next 5-year Arctic research plan. And today I'm just going to quickly give a little bit of background about IARPIC, what is the Arctic research plan, how it is developed, and how each of you can contribute. So those of you who don't know, IARPIC is made up of 16 federal agencies, departments, and offices from across the U.S. government, and it is charged with enhancing both the scientific monitoring of and the research on local, regional, and global environmental issues in the Arctic. Next slide, please. As you can see here, IARPIC is within the executive branch of the government, and this interagency group falls under a committee within the Office of Science and Technology Policy, and our host committee is the Committee on Environment, Natural Resources, and Sustainability. And we became a part of this National Science and Technology Committee back in 2011. Next slide, please. IARPIC has both a federal-only and open components. Parts of IARPIC are federal-only and are responsive to the needs of federal agencies. The other parts of IARPIC, distinguished as IARPIC collaborations, are open to anyone who is interested in participating. IARPIC collaborations hosts a wide variety of members, such as yourselves, and encourages discussion across these boundaries in order to improve Arctic research. You can see on the right-hand side of the slide the 9 collaboration teams, along with 3 sub-teams under the Environmental Intelligence Collaboration Team. The team structure here is based upon the current Arctic research plan for the years 2017 through 2021, and each of the teams correspond directly to a research goal in this plan. And the teams are tasked with completing the performance elements outlined in the plan. The next plan might have a very similar structure, but it's also possible that it might change in order to fit current research needs. Next slide, please. Here you have a graphic that shows the 4 policy drivers that were our overarching issues that we use to help develop the current plan. And as you can see here, they relate to enhancing the well-being of Arctic residents, advancing stewardship of the Arctic environment, strengthening national and regional security, and improving understanding of the Arctic as a component of planet Earth. We then used these to create the 9 research goals, which you see on the outer edge of the circle here, defined in different colors. And within each of those research goals, there are performance elements for each of the collaboration teams to strive to advance. Next slide, please. By law, IARPIC develops and implements an Arctic research plan every 5 years with the goal of improving the collective impact of federal agency investments in Arctic research. IARPIC is now beginning the development of the Arctic Research Plan 2022 through 2026. Next slide, please. This slide shows you all just a few facts to consider as you think about helping us develop the next plan. These plans are designed to align with the goals and missions of the 16 federal agencies that that make up IARPIC and support research in the Arctic. As I've mentioned before, they are U.S. federal documents, and the plans focus on research which will be enhanced through cooperation between federal agencies. However, it's important to keep in mind that these plans do not attempt to address every aspect of Arctic research. To date, the plans have primarily focused on basic research, but we could also include applied research in the plans as well. And we welcome ideas for research in any natural or social science field. Next slide, please. This slide provides you with a little schematic of our process and our timeline. So back in the fall of 2019, we received approval from the IARPIC principals to begin working to develop this next 5-year plan. We formed the small interagency plan development steering group. We also then, amongst ourselves on the development team, created 2 sub-teams, one focusing on an engagement strategy and to begin outreach to a broad suite of stakeholders and users, And we also created a team to help plan a development workshop. Since January, we have been meeting monthly, and we have, the team has put together a Federal Register notice to solicit public comment. You'll see more about that on an upcoming slide. And we've also started public input and listening sessions and webinars, such as all of these collaboration team meetings. Once the scoping phase ends, we hope to begin drafting the plan later this year, late fall, early winter. And it's important to note that we have not started drafting anything yet. This scoping phase is incredibly important to our process. We then hope by next spring to have a draft of the plan out for folks to review and provide additional comment, with the goal of getting this cleared all the way through the Office of Science and Technology Policy by late 2021 so that we can begin implementing in January 2022. Next slide, please. Here, as I mentioned, is a little bit more information on the Federal Register notice, which originally went out on April 3rd. We then did, several weeks later, post a second Federal Register notice extending the public comment period by 30 days through, it is now open through August the 2nd. And in the notice, in addition to outlining why we do the plan, we put in there the two primary issues for which we would like people to provide us input during this scoping phase of the process. And as you can see here on this slide, that includes content of the plan, so the critical issues that we should be considering through federal cooperation, and also the organization of the plan itself. For example, the collaboration team structure that exists now was created to be responsive to the current plan. And so we would love to hear if that organization is working or if we should consider something different starting in 2022. Next slide, please. Here are the different ways that you can provide input. As I mentioned, you can submit directly through the Federal Register. And we also have an email address listed here. We have an online form on the IARPC Collaborations website, as well as the ability to direct message on the IARPC Collaborations Facebook page. In addition to these collaboration team meetings, we are also holding additional public webinars. And lastly, we would love for anyone who has strategic plans for their agency, organization, to please submit that, and Meredith can take those for you. She's our repository for those plans right now. Next slide, please. And this is the final slide. And just to let you all know that in addition to the amazing Secretariat support from Meredith, we also have a Plan Development Director, Nikush Carlo. She might be familiar to some of you. And so if you have any questions, please feel free to reach out directly to Nikush or Meredith. And Sarah, I will turn it back over to you, and I'm happy to take questions.
Great, thank you, Candace. It looks like there might be.
I'll have to ask my dog to translate that question.
Okay, I'm just gonna take over for Sarah here for a second. So we do want to make sure we have plenty of time at the end to have a good discussion. I think if there are any quick questions about IARPC in general, we can take those now. And so there's one in the chat: how do you handle tribal consultation?
That's a great question, thank you. And so one of the sub-teams that we created within the Plan Development Steering Group is focusing directly on engagement with Indigenous organizations, communities, tribal governments. And we have been working on a strategy to work directly with them to gather their input. We had hoped to conduct in-person meetings in several of the hub communities, but of course the ongoing COVID-19 pandemic has forced us to cancel those. But our plan development director, Nikush Carlo, has actually been in direct communication with several organizations to work out right now how we will work directly with them to gather their input.
I think we have time for one more
Sorry.
question. Okay, I'm going to then hand it over to the health leads for their kind of overview of the health chapter.
Great, thank you, Meredith. Sorry everyone about the dog barking. Well timed, right? I will start off. Meredith, are you able to pull up our slides?
I can, yes.
That'd be great.
Thank
you.
Mm-hmm.
All right, great, thanks. And thank you again, Dana, for these lovely slides. So we are going to talk a little bit about what the Health and Wellbeing Collaboration team has focused on in the 5-year plan that we're currently working under. This slide just kind of lays out what we've already talked about. Mission of our team is really to enhance the understanding of health determinants and improving the well-being of Arctic residents. So as you can tell from this mission, our team is quite broad in what we do. Next slide, please. All right, so this slide really just highlights some of the federal agencies and non-federal partners that have been involved in the health and wellbeing team over the past few years. This is not everyone, but Alaska Native Tribal Health Consortium has been very involved, as well as some local tribal health organizations such as South Central Foundation, Bristol Bay Health Corporation, Yukon-Kuskokwim Health Corporation. Then you've got state of Alaska agencies such as Health and Social Services, Fish and Game, Environmental Conservation. The University of Alaska system has been really involved through UAA and UIF. And then some other agencies such as Alaska Energy Authority. And then, you know, your federal partners such as EPA and CDC and National Science Foundation, NIH, the list goes on and on, which is pretty cool. Like through this team, I know I myself have really gotten a bigger understanding of work going on in the Arctic, especially Alaska, and then really expanded my network. So I think that could be said for pretty much anyone who's been involved in these calls. Next slide, please. Okay, so as Candace displayed in one of her really great slides, the Health and Wellbeing team, as well as all the other collaboration teams, has research objectives that really guide the things we focus on. So we'll just do a real quick overview of these objectives. There are 7, so we won't take too much time on them. But our first research objective, probably one of the broadest ones we have, is to support integrative approaches to human health that recognize the connections among people, wildlife, the environment, and climate. So through this one is where we do a lot of our One Health work. We support the regional One Health group, the LEO network that is maintained by ANTHC. That's the local environmental observer network, which is a really great resource that really follows environmental change and connects local observers to experts in a particular field to address questions on things that may be different in the environment. Through this research objective, we also focus on a couple other ANTHC projects, the Maternal Organics Monitoring Study for persistent organic pollutants, and supporting some other community-based environmental networks focused on zoonotic pathogens, mercury, other contaminants. We had a whole call about changing permafrost conditions and mercury levels and related that to health. Paralytic shellfish poisoning has also been a topic that we've looked at here. So we'll just keep it to that for this research objective 1. Next slide, please. So the second objective is to promote research, sustainable development, and community resilience to address health disparities associated with underlying social determinants of health and well-being. A couple of our performance elements relate to characterizing health consequences associated with decreased access to in-home water and sanitation. That has been work with ANTHC as well as some state of Alaska agencies such as Department of Environmental Conservation and Health and Social Services. Supporting research on health impacts of poor indoor air quality. We've also kind of loosely looked at this one for also looking at outdoor air quality. And we had a couple of meetings focused on wildfire smoke exposure last year, when we had quite a few very large fires in the state. And so those were some pretty interesting meetings that came out from this research objective focus. There's also one that's a little different to fit into this particular research objective, but supporting the connection of Arctic residents with museum collections and archival materials. That's the National Science Foundation connection. Next slide, please. So the third research objective, promoting food, water, and energy security in rural and remote Arctic regions. Food security has definitely been a big focus of this research objective in terms of access, quality, quantity, just really mental health connections too. We've also worked to support the Alaska Department of Environmental Conservation, Alaska Water and Sewer Challenge, promoting research on renewable, efficient, and sustainable energy systems. And that's something with the Alaska Energy Association, or Alaska Energy Authority, and some other groups. So we'll move on to less of this more broad focus and onto some of our other research objectives. I think Dottie might be next.
Yes.
Great.
Thank you, Sarah. So the fourth research objective is to document the prevalence and nature of violence against Alaska Native women and youth, and to evaluate the effectiveness of governmental and tribal resources or responses to that violence. And the activities around that have been to conduct a national baseline survey to address Alaska Native women's experiences with violence and victimization and service needs. And, last year, toward the end of the year, we had, we examined the contributions that the village public safety officers made to rural communities and evaluated the criminal justice response in rural communities. And this included a meeting that reported on Attorney General Barr's visit to Alaska. And this report was made out of the Department for Tribal Justice in the Department of Justice. In addition, we look at determining effective methods to assess violence and victimization among Alaska Native youth. And can you change slides now, please? And then our fifth objective, on which there's been a considerable amount of work, is to increase understanding of mental health, substance abuse and well-being for Alaska youth, specifically in programs or support to programs that strengthen resilience. And there is a particular project that's been funded through the National Institutes of Health, the National Institute of Minority Health, co-funded grant that was primarily funded by the National Institute of Mental Health. And one of the things that or among the things that it did was to answer some of these objectives, which were to increase knowledge and evidence for effective community-determined approaches for the well-being of children and youth, conduct surveys to document and report on adverse childhood experiences in Alaska Native children. I'll say more about that in a minute. And support tribal behavioral health programs and collaborative research hubs to promote resilience and reduce the burden of suicide in Alaska youth. This final objective has really been advanced quite a bit by a research group out of the University of Alaska Fairbanks that's working in hub communities, and then from there in 64 Alaska Native villages to look at resilience factors that are associated with reduced suicide burden in Alaska Native youth in those communities. And then just to go back to the documenting and reporting on adverse childhood experiences, our last meeting in May included a report by a couple of researchers, a researcher from ANTHC, Dr. Matt, why am I blanking on his name right now, Hirschfield, and Dr. Jared Parrish at the Department of Health at the Alaska State Department of Health, who talked about adverse childhood experiences and the interventions that have been developed by the Alaska State Department of Health to address some of those, the consequences of adverse childhood exposures. And I will hand it over now to Dana.
Dana, you might be muted.
Can you hear me now?
Yes.
Okay, great. Yeah, so I'm going to just go over the last couple of research objectives here. Number 6 of which is to support the reduction of occupational safety and health hazards in the Arctic. So this is a research objective that's primarily supported by the National Institute of Occupational Safety and Health at the CDC, and as well as the Alaska Departments of Health and Human Services. Their Department of EPI are 2 of the primary partners, along with others. So the performance elements are to document and describe occupation risks using EPI surveillance data. This is primarily focused recently on the commercial fishing industry and then the water and air transportation industry. And one of the things they've done over the last 5 years is to expand the EPI surveillance to also look at the Alaska workers' claims surveillance data as well. So, and then they're also tasked with conducting prevention-oriented research addressing fatal and non-fatal injuries at the workplace. And so NIOSH has been involved recently on a study looking at safety practices among aviation companies in Alaska. So that's one of the things they're moving forward on. So can I get the next slide, please, Meredith? And then the last objective is, again, pretty general: improve the quality, efficiency, effectiveness, and value of healthcare delivery in the Arctic. This is, again, pretty broad, but the performance element there is in collaboration with ANTHC to promote research on how telemedicine applications can improve healthcare delivery and patient outcomes. So ANTHC is involved on a daily basis in improving telemedicine and their outreach to rural Alaska and local communities. So this is sort of to support where we can those efforts. So next slide, please. So now we just wanted to move into a little bit of a listening and brainstorming from others on the phone call. We do have the chat box, and if we get to the end of the call and you haven't been able to let us know what you think about, input for the next 5-year plan, please feel free to send any input to either Meredith or Nakush is the 5-year plan development director, or any of the team leads. So. And so then we appreciate your time and getting involved in this phone call. I know it's a real challenging time with everything going on with COVID, to carve out time to sort of think about the last 5 years and then plan for the next 5 years. So given sort of the situation we're in right now, I know it's a challenging time to plan. But still we're moving ahead with this planning process. And so our first couple of questions that we were looking at is what of the 5-year current plan we're doing well, what of the objectives should continue, and then are there any thoughts on sort of components of Arctic health and the well-being of Arctic residents that we're missing? And then just as a sort of brainstorming question as well, what has changed since 2016 in terms of the health needs? So the last time we were going through this planning process was 2015 and 16, and to sort of think about how have things changed between now and then. So those were our two sort of first brainstorming questions, and would like to just open it up for thoughts, input, and further questions from everyone. Go ahead. I saw from the chat box that the question being, does IARPC provide funding to support these research objectives? So my understanding, and correct me if I'm wrong, Meredith or Sarah, that we don't actually, IARPC itself doesn't have money to provide funding, but how we do it is we try to make the bridge between federal funding opportunities and get that out to Arctic residents. So if a funding opportunity does become available within NIH or CDC or other federal health agencies, then we try to make sure that the appropriate collaborators get that information and are aware of that funding opportunity. So.
This is Dottie, and I agree, Sarah. I agree, Dana, and we very often have that entered on the website as opportunities for federal funding applications being accepted and so forth. And I think Candace has a comment.
Yes, thank you. And great question. I should have mentioned that in my presentation. When we put these plans together, they are not aspirational plans, but we try to include in the plan things that are already funded by the agencies that make up IARPC or that have a high likelihood of being funded.
Great. So I guess just my own thoughts on what we're missing. I feel like the documentation of health consequences of lack of sanitation facilities, that's obviously still an area that needs work, as I believe a third of rural communities still don't have complete sanitation and running water. So that's something I would imagine we would want to continue in the next plan and continue to advocate for. In my mind, sort of issues with food security and safety are, of course, things that need to continue in the next Arctic research plan. With all of the changes going on in the Bering Sea ecosystem, the need for that, in my mind, has even accelerated to some degree. So those are sort of the two things that I had identified that I think need to continue. And then what's changed since 2016, I guess, big changes are, of course, the pandemic that we're dealing with right now. And then I think the speed of sort of climate change in Western Alaska and Northern Alaska has perhaps increased more than we could have even anticipated back in 2015 and 16. So.
And this is Sarah, to kind of go off of the what's changed. Something that I know as a team lead, I noticed that really wasn't like an obvious performance element to any of these objectives, but something that had been popping to the minds of various agencies. And actually there has been some federal research in Alaska. Is a focus on wildfire smoke impacts. And I know that's something that other collaboration teams have worked on from the environmental side. So that potentially is something that may be worth considering. But does anyone who's not a team lead have any thoughts on maybe how things have changed? What might be missing?
Bubbles, not to put you too much on the spot, but I'm wondering if you might say something about what you're seeing out in communities in which you're working and so forth.
Dottie, who is
Did you say Bubbles?
I did.
Okay. Thanks, Dottie. So as Dottie had mentioned in one of the slides with the research on in communities for suicide reduction and youth. So I was a part of the ARCUS interview team. I would call individuals in the communities. There was a team of us that would do that, and it was a very good experience. And right now, I was recently added on to the CANAR team, which I'm still learning a little bit about. Right now, I'm kind of shocked to be called out a little bit, so give me my brain a little bit. So what we see out here in regards to everything, I'm very happy to see that everything is making a connection to what we're currently seeing. For instance, erosion, permafrost melt, and how the effects are, like even just for myself, like for instance, my fish camp that I grew up at is no longer exists because that whole piece of land is eroded, and the experience it's having on me, and then witnessing that on other people and how affected they are and how traumatic it is actually to witness these things. And it was a real honor to work with ARCUS in gathering knowledge from across the state of Alaska and seeing what each community does or what they have in place, even with limited resources, what they try to do to make up for the lack of resources in order to promote health and well-being for their upcoming children, future generations. The culture is still running strong, and it's one of the backbones, I believe, in how we are going forward, despite everything that we're currently facing. Those are just a few things that came up right now that I thought I would just mention. Thanks, Dottie.
Thank you, Bubbles. I really appreciate it, and I'm sorry for surprising you. I apologize.
Oh, sorry, somebody else is speaking. I'll go next.
No, go ahead.
Okay. So this is Liz Ferrucci. I actually, Tom Hennessy had talked to me when you guys were putting together the previous one, or at some point during the last 5 years, about number 7, the telemedicine research. So I currently have a funded R01 grant looking that's funded to ANTHC, looking at telemedicine in chronic disease by AHRQ. I had a previous grant that he had me present on as part of this plan. I will say that with the pandemic, there's been a dramatic expansion of use of telemedicine, not just in Alaska, but everywhere. And so the research needs may change around that. But I think keeping it on there makes a lot of sense.
Great. Yeah, and I know I was speaking with Brian McMahon at ANTHC as well, and I believe that they are working with NIH on some grants as well to support telemedicine and get hepatitis C treatment, potentially evaluating the ability to get that out to rural villages. And so that does seem like one of the research objectives that would be worth carrying forward, especially like you said, Liz, with COVID and sort of taking advantage of that increased use and what benefits have come from it. So yeah. Any other thoughts on these questions at all from anyone else?
This
Otherwise,
is I just have a quick question, and it's not necessarily on the research question themselves, because I think that they're all great, but I'm wondering, and maybe I just missed this, what the plan is, or if it should be incorporated into the plan, things like data dissemination and research, return of research results, and health communication around these results, because I'm just thinking about, and I don't know any other way to describe it, so I'm sorry. I'm thinking about some of the crusty old Alaskans I know who just don't believe in the work that we do. And I'm wondering, like, maybe over the next 5 years, we should be thinking about how to do a better job with health communication, to really be sharing the great work that we are doing across the Arctic, and maybe get some of those people who can see that our landscape is changing, but somehow refuse to acknowledge that, like maybe to get more people on board, I guess is what I'm saying. And it doesn't have to necessarily be those people, but I think that there's some great work being done that we should definitely be sharing.
So this is Dottie. Thank you, Sarah. That was really a great comment. There's the NIH just issued on Friday 4 funding initiatives around testing in underrepresented communities. It's under the name of a program called RADx Up, Rapid Assessment of Diagnostics in Underrepresented Populations. And one of the big issues in that is to be able to get testing out into the communities that really need it, but also to be able to get results back to the community members as rapidly as possible. And I think that this is related to health communications and health literacy as well.
And I will add to that and say that this is getting data dissemination and getting the results of research back to communities, people in the Arctic who are interested or might use the information, is something that IARPIC is thinking about more broadly than just the health team. It's a challenge that we have.
yeah, and I mean, it feels particularly important for the health team to get the information and the good work that's being done back out to the communities. So I think that is a great comment, and whether we could build that in as an objective or looking at the best ways to get the information back out to the community. And the work that is done collaboratively, I guess, across teams as well. So some of the issues with food security are particularly cross-cutting, I think, with the permafrost team and the loss of sea ice team. And so finding ways to sort of get that information in a digestible format back out to the community is a good thing to think about as we move forward, I think. So. And I think just, it'll be interesting to see how the IARPIC group is going to engage, I guess, the communities, the Arctic communities, just because I think, you know, always needed and always a huge emphasis is for research to be community driven out of local communities. So I'm not familiar with what they're planning to do right now, given they can't travel to any of the rural hubs, but they are working on that plan. So, yeah. So Meredith, do we maybe want to go to the next slide? I think we had a couple other questions for folks. And maybe move to even the next slide. So I guess my thoughts in the last few minutes are, you know, the cross-cutting themes, I guess, that are of most importance, to talk about that. And then if folks can think of anything that isn't in the plan, so like new areas that they see a need for, I guess that would be 2 thoughts for our final few minutes here. Okay. I guess I'm new to the IARPIC process a little bit, but my main, I think, cross-cutting themes where we benefit, the health collaboration team benefits most by interacting with the other teams are on food security. So what the science that's being done in the other teams impacts food security the most. So that would be sort of a cross-cutting theme that I would definitely want to move forward into the next plan. So I guess that's my, yeah.
Janna, I think related to that, from my perspective, it's what I see is the impact on health and mental health from some of the other activities in the other teams, or that some of the research show might shed some light on. So linking research on the Bering Sea ice melt or permafrost melt with health outcomes in those communities. Does Bering Sea ice melt that influences migratory patterns of fish and birds and other kinds of animals then have an impact on food security, which then has an impact on mental health as well as other health outcomes? And the same would apply with permafrost melt. For those of you who are, since I'm not in Alaska, those of you on the ground in Alaska, does that resonate with you? Does that make sense?
I mean, oh, go ahead.
We got a chat box, yes, for you, Daddy.
Yes, I agree. I see that. Thank you.
Yeah. I mean, and I think moving forward too, I mean, you've got all of the need for mental health resilience with everything happening in the Arctic. And you combine that with adverse childhood experiences, and then you combine that with what's happening now with the pandemic and both community and individuals' isolation. So looking at mental health, well-being, and resilience, that certainly, I think, is a cross-cutting theme that we need to carry forward as well. So
I agree. Thank you.
yeah. Yeah. Yeah, and then I mean, I think for me, in terms of of the structure and the way we're set up with the health and well-being collaborative team, but then we connect with other teams that are doing more of the physical science surrounding climate. I haven't had enough experience on the team yet to see how that's working, but you know, as far as I'm concerned, you know, it's the structure seems to be working well, particularly the structure within the One Health group that Mike Brubaker leads at ANTHC. So for me, the structure seems to be working pretty well, but. All righty.
Does anybody else have any other thoughts?
I will just, I know that it can be difficult to ask people to answer these questions kind of spontaneously, but pointing people again to the Federal Register notice, the online form, emailing, or reaching out to the team leads of this group with your thoughts, I think if you want to take time to think them over, are all great options, and we'd love to hear from you.
Great, thanks, Meredith. Yeah, and we'll also in July be having a team lead workshop. So at that point in time too, I think we'll be discussing sort of what to move forward and what to leave behind in the 5-year plan. So.
And I am grabbing a couple of the comments from Anne and then from Andrea. Anne mentioned mental health around rapid hazards and disasters. And Andrea mentioned health literacy, figuring out where and how people and get information that impacts their health.
Great. I just want to thank everybody again for their time during this, during the COVID pandemic, and for joining us and thinking a little bit about this next 5-year plan. So thanks, everybody.
Thank you.
Thanks, everyone.
Thank you.